Today we're going to talk about the most common cause of heel pain, which is plantar fasciitis. Now, not all heel pain is plantar fasciitis, but probably about 90% of it is. And we want to find out today what is the cause of plantar fasciitis, what are some of the signs and symptoms, and what we could do to get rid of it. Plantar fasciitis is probably one of the most common things that we see here in the office. And what happens is patients usually get severe pain on the bottom of their heel, typically on the inside of their heel. And this pain will usually present itself first thing in the morning. And patients then will have an alleviation of this pain as they walk a little bit and loosen the area up. This pain can reappear after we have a long period of sitting and the patient gets back up. They'll again experience similar pain to what they did earlier in the morning. Plantar fasciitis is an inflammation of soft tissue that attaches to the heel. The plantar fascial tissue is a connective tissue that helps to support the arch, certain tendons and ligaments and joints in the bottom of the foot. And the plantar fascial tissue runs from the toes all the way to the heel. Now, what would cause this area to become inflamed? A lot of times certain foot structures where the foot tends to flatten out a little bit when we walk puts an extra stress and strain on this tissue. A lot of times improper foot gear. Sometimes we'll have patients that were away on vacation in a sandal or walking barefoot will wind up with this problem. A lot of times a tight Achilles tendon will cause extra stress and strain on the bottom of the heel. When we see a patient with this, the key is to diagnose this correctly, because not all heel pain is plantar fasciitis. So we usually will have an x-ray taken here in the office or do a diagnostic ultrasound to determine how the plantar fascia looks and to see if it's inflamed or thickened. And from the patient's history, we can also determine the right diagnosis. And once we have the right diagnosis, the goal then is twofold. We want to get rid of the inflammation, and then we also want to support this tissue to prevent the cause of this inflammation. So to get rid of the inflammation, typically we will give an injection of an anti-inflammatory medicine. Sometimes we'll put patients on an anti-inflammatory by mouth, and sometimes even a patch form can help get rid of this inflammation. And typically we'll want to have patients wear the proper shoes, and sometimes we'll make a molded arch support to take away some of the stress and strain that's present that's causing the inflammation. Some other modalities include physical therapy. Sometimes we'll give patients a splint to wear at night, and sometimes in severe cases when the condition doesn't alleviate itself with these conservative modalities, we will use minimally invasive treatments such as a radiofrequency ablation, which is energy that's put into the tissue that will create changes within the tissue and allow patients to walk on their foot the same day we do it and help alleviate the problem. But really the key is early treatment. We don't want to have patients wait too long. The longer we have this problem, the harder it is to get rid of it. But with early treatment, we are able to get rid of that in a relatively quick fashion.